So my name is Sunnyo. I am the director of several programs, which is Adult Alcohol and Drug Treatment Program, Adolescent Alcohol and Drug Treatment Program, Program Gambling Treatment Program, and also New Leaf Recovery Center. So all the mission is to assist people with certain addiction or mental illness to have a better life through recovery.
What I do is I provide individual therapy primarily to the Spanish-speaking population. Also work with the teen population.
New Leaf is basically a co-occurring program. Clients can come and get both their substance use, like addiction recovery needs met, and also their mental health needs met.
So COVID came, it changed a lot of different things for us all of a sudden. One of the big things was just losing that face-to-face interaction. We went from having about 3 times a week where we would be face-to-face with the client to all of a sudden only having a phone call.
While social distancing is very difficult for any of us, it hit one group particularly hard.
So the first thing that comes to mind is those first few weeks of COVID-19. I had clients who were immediately facing barriers related to employment, which impacted their housing, which impacted their stress, which impacted their relapse. And so on top of not being able to come in for that face-to-face support that lots of clients have been relying on, right? Being able to see a whole bunch of people who were in it with them together and providers who could support them through the highs and lows, that's gone. And on top of that, trying to get food, trying to access transportation, but all of the buses are closed.
So when you're talking about clients dealing with isolation and anxiety above what they already dealt with in the past, it makes it like twice as difficult to kind of handle their needs.
And that was one of our main concerns. How do we not have our clients relapse during such a difficult time?
Fortunately, we are a very, very well-trained team of professionals that were also able and willing to adapt.
During COVID, we've really had to become very creative. How do we teach somebody a coping skill all of a sudden if they're just in their home and they're so used to going to the gym?
We have extended our services via telephone calls, via telehealth, Zoom meetings, and in general, it was a little bit more of a challenge, but I think we have managed to make that happen.
Some of our clients are homeless and they may not have even a phone with the data. So we had to call every one of our clients and made an assessment what they are available. And then we adjusted our services accordingly.
We constantly contact them to make sure that they were okay with the medication, that they were doing what they were supposed to be doing, and just in general, let us know how we could be of help.
That's one thing that I know for myself and lots of the counselors here, we'll find ourselves calling at least 3 or 4 times a week, like, noticed you missed your group, how's everything going, what's going on, and just providing that extra support.
I was gonna be homeless, but they made sure that I got into UPAC, did the intake, they got me a sober living right away. They had everything set up, and my funding was paid for, my rent for the first few months. I have a psychiatrist at UPAC, I have a substance use counselor, I have a mental health therapist. It's very cleansing, renewing to have these people here on my side.
Because the stake is higher now, we are really entering in a so-called COVID perfect storm to really trap clients for relapse or more anxiety, more fear, and more isolation. The sense of mission is higher than ever, and I'm very, very proud of our team.
It's really important for our clients to continue to have services just because COVID has stopped a lot of different programs like AA groups. Clients were going to those 3 times a day, and all of a sudden they were just completely shut down. Being able to kind of have somebody to express their fears about what's happening.
And it's been a major part of my recovery because I've been able to have people to talk to about my mental health when it wasn't so good. You know, there's days where it's not that good, but I can reach out to UPAC anytime. Like, thank God for this place, because I don't know where I would have been without it.